This paper was published in Blood earlier this year, and this was an analysis of patients in the UK and in Australia who'd received either venetoclax and a hypomethylating agent or venetoclax and low-dose cytarabine as their first therapy for AML. Most were unfit for intensive chemotherapy. So we know with venetoclax and hypomethylating agents that flow cytometric MRD does predict outcomes, and this was data from the VIALE-A study published by Keith Pratts and colleagues a few years ago. But there's never been any demonstration of the use of molecular MRD, similar to what we would do with intensive chemotherapy. And it wasn't immediately clear that within a long-term continuous therapy that the MRD would necessarily matter so much. So we took a cohort of patients with NPM1-mutated AML, 70-something patients, I don't remember the number exactly, who had been treated in the real world and who their clinicians had performed molecular MRD in their bone marrow or blood during their therapy. We showed that about 58% of these patients, all of whom were in remission, achieved MRD negativity at some point in their therapy, and the patients who achieved MRD negativity did really very well with a 2-year overall survival of over 80%. We also tried to identify an early time point and threshold by which you could predict later outcomes in patients, and the best threshold we could identify was bone marrow MRD negativity by the end of the 4th course of venetoclax-based therapy. And in these patients the relapse rate was very low, and indeed a number of them were able to stop therapy. 22 patients stopped therapy in MRD negative state and only 2 have relapsed since. So we showed that MRD is very prognostic. Patients who don't get a good MRD reduction did quite poorly, more than 75% of those relapse, whereas patients who are bone marrow MRD negative within the first 4 cycles did really well. The next step with this sort of data is to see whether you can do anything about it, whether the MRD negative patients can safely stop in a prospective study, and whether the MRD positive patients could be escalated or a third agent could be added or something similar to that.